I'm Juliana. I'm going to be your student nurse today. Can I have you confirm your name and date of birth?
Annabelle Joyce, August 1st, 2004.
And I would verify that either in her chart or on her bracelet, and then perform hand hygiene. Is it okay if I record a video for a class?
Yes.
Okay. So then I would note that the patient is sitting upright, is alert, awake. There's no signs of distress, no labored breathing, no lesions or discoloration of the skin. Grooming appears to be intact. And I would start by assessing her radial pulse. So can I have your wrist? And I would assess for 30 seconds and multiply by 2 and expect it to be between 60 and 100. So we'll say 72. I would do the same thing with her respirations. I would count for 30 seconds and multiply by 2 and expect between 12 and 20. So we'll say 16. On a scale of 0 to 10, what would you rate your pain today?
0.
Okay. Do you know what town we're in?
Sterling.
Do you know today's date?
April 7th, 2023.
And what is your first and last name?
Annabelle Joyce.
So I would be able to say the patient is alert and oriented times 3 and is able to follow commands, speech is clear. And so then I would start with inspection. Can I have you turn your neck to the right? And I'm looking for JVD. So there's no signs of JVD. I would inspect the skin again. No changes in coloration, no lesions or breakdown. So we're going to start with the musculoskeletal exam. It should take about 10 minutes. So we're going to start with range of motion. So I'm going to assess extension. So can you look up at the sky? And flexion, can you touch your chin to your chest? And rotation, can you look over both shoulders? So there's full range of motion in the neck. Then I would assess for tenderness or pain. So I'm just going to touch your neck. Any pain?
No.
Only ticklish. I'm also going to assess the trapezius muscle and cranial nerve 11. So I'm going to push down on your shoulders. I want you to try and push up. Good. So cranial nerve 11 is intact and there's equal muscle strength on both sides. So then I would move on to the upper extremities. Again, skin for the upper extremities appears to be intact and symmetric. There's no lesions or breakdown. There's symmetric muscle bulk. There's no signs of atrophy. So then I would start with palpating for tenderness. So I'm just going to palpate. Any pain?
No.
Okay. Can you move your arms back and forth? And I'm not hearing any crepitus. And I didn't feel any masses either. So then I already took her radial pulse. It was +2 bilaterally. And I'll do her cap refill. So can I have your fingers? And I'm expecting less than 2 seconds, which it is, which means she has good circulation. I'm going to check your strength. So can I have you put your arms out in front? And I want you to try not to let me push them down. So her strength is +5 out of 5 bilaterally. So then I would assess her range of motion. So for flexion and extension, can you bend your arms up and then extend them back out? Can you raise them all the way up over your head and bring them back down? And then can you put your hands out in front and can you turn your hands upward and back down? And so she has full range of motion in the upper extremities. So then I would move on to the lower extremities. Again, I would examine the skin. There's no lesions. Skin is symmetric in coloring, no skin breakdown. And musculoskeletal, no musculoskeletal deformities, no signs of atrophy. So I'm going to palpate again just for tenderness. Any pain?
No.
Ideally, I would have the patient's feet straight out in front of her as well. So then I'm going to assess her pedal pulses. So I would do that on the top of her foot and expect those to also be between 60 and 100. And I would do the cap refill of her toes as well and expect it to be less than 2 seconds. But I'm not going to do that because she has shoes on. So can you hold your feet out in front of you? And I'm going to try and push them down. I want you to try and hold them back up. Okay. So her strength is 5 out of 5 bilaterally. So then I would assess her range of motion. So she just lifted her legs up and brought them back down. So that would be her elevation and depression. Can you move your leg in and out? And the other one? So that would be her adduction and abduction. Can you point your toes and flex them? So her plantar flexion and her dorsiflexion. So she has full range of motion in the lower extremities as well. So then I would move on to the posterior aspect. So I'm just going to turn you a little bit so I can see your back. And I'm going to stand behind her. So I would inspect again her skin. I don't see any signs of musculoskeletal deformities. There's no lesions. There's no skin breakdown, and skin is symmetric in coloring. Her shoulder, there's equal rise and fall of her shoulders with respirations. Her spine is located midline. And I'm just going to palpate for tenderness here. Any pain?
No.
Okay. So then I would assess her range of motion again. So can you lean forward? Can you lean backwards? Can you arch your back a little bit? So she has flexion and extension. Can you bend to one side and then to the other side? So she can laterally bend. Can you rotate? And she has full rotation. So she has full range of motion of her spine as well. And there was no mass or tenderness. So that concludes today's exam. Do you have any questions?
No.
All right, thank you.